Welcome to August 1st COVID update. I don't remember how many of these now it is, 20 maybe? I think maybe this might be 20 that we've done since February of last year. And as is traditional, each month things are pretty different than they were the month before. So I'll go through the normal kinds of exposition of what's been happening, look at overall outbreaks progressing in the world and within regions, and then look at the global models for the 50 biggest national outbreaks by country, and then the US models for states, and then the California models for counties, and then update a few things about variants and vaccines. Those I think are going to be ongoing topics, and then that'll be it today. So not a big special topic this month. So in summary, as I think everybody probably knows, global daily cases are roaring back from the recent minimum they reached in June. They've about doubled since then. And they're getting pretty close to the peak in April when India was the biggest outbreak. So we're approaching as high as, again, at the global level, as high a new daily case rate as we've had at all in the pandemic. The resurgences are pretty broad. You'll see that on the regional graph. You can find them in all regions. It's been getting more spread around kind of as time goes on, and this resurgence is a little bit more broad, where you could see it in Southeast Asia. You just see it all over. And some of the regions, like Southeast Asia, are regions that really have had relatively low case rates. A lot of these countries were viewed as succeeding very well in avoiding or controlling the pandemic, and several of them are now very much out of control. So, and of course, that's a region where vaccination rates are pretty low. The new variants of concern continue to emerge. I'll talk a little bit about a new one that's a little bit too early to tell, but maybe an up-and-comer. And then, of course, Delta, that everybody's heard about, has made a big inroads in becoming the most prevalent, both in the US and in the world over the last month. Vaccines continue to get distributed all over the world. They're growing in a lot of the Western countries, and the US included, maybe even more than many others. Daily vaccinations are declining. I'll show just a couple little correlations locally and in the US about vaccinations and progression of the pandemic. Many countries and states now require a 5 outbreak model. So remember back in, I forget when I added the 4th outbreak, I think it might have been 3 months ago. So we've made it through the first year and some of the pandemic with 3 outbreaks. But now in the US, for example, there really are 5 distinct outbreaks you can see in the derivative data. But I haven't done that yet, because it's quite a large amount of work, and I didn't have time this weekend. So consequently, really for the first time, I think some R-squareds, broadly R-squareds, have gone down a little bit, because many of the outbreaks really need a 5 outbreak model to properly fit them. And even this late in the pandemic, there's some data anomalies happening. Delaware dumped in months worth of deaths all on Friday this week. Florida has moved to reporting things weekly, so their cases look flat for a week, and then they jump up by 100,000 cases. So there are various little inconveniences in some of the data issues. Some have been going on for a long time, like Ecuador, and some are new. But I'll point those out when they are material. So starting at the world level, these are the data I gathered Friday night, as usual, from the Johns Hopkins aggregated database for US county level and state level, and then country level for the world. And this is the progression of outbreaks by size that I show every month. From last month, where we saw a little bit of an uptick, relatively smaller growth in the mid-size kind of outbreaks, and continued very low growth in the small outbreaks. That's been true for many months. But this month, pretty broadly across these relatively large outbreaks from 100,000 cases to 5 million cases, there's been a 15 or 20% increase for the most part in all those categories. So all the countries that were kind of settling out for the most part in that range now are surging, and there is growth in the number of those mid-outbreaks. There has not been increase in the number of outbreaks greater than 10 million. So the really, really big outbreaks like the US and India and Brazil, really, those are the 3 countries in that category. There hasn't been another country join that one, but all the rest are kind of taking an uptick in the rate of growth of the large outbreaks. The changes in the top 50 this month are also reflective of some of this broadening of some of the case growth. Tunisia entered and Thailand entered. So one in North Africa, one in Southeast Asia, and Belarus and Paraguay dropped out, if anybody's keeping score. You know, some of these near the bottom are seeing pretty low case growth, and then some countries have moved up a couple categories. So it continues to change as things spread around the world. And I'll show the outbreaks for Tunisia and Thailand, I think, on some of the individual region pages. From a regional perspective, I think the main thing that distinguishes this month from a month ago, last month, there were a couple regions, South Asia and Latin America predominantly, that had a significant fraction of the global cases. You could see sub-Saharan Africa was coming up a little bit, but Western Europe remained pretty low. North America was pretty low. And now I think this is about as even a distribution of new cases, particularly during a surge, that we've seen during the pandemic. So I can't point to, well, 40% of the cases are from South Asia like they were a couple months ago. You know, 25% from Europe, 20% in Latin America, 15% each in South Asia and Southeast Asia, 10% in North America, and now 7% in Africa, which is as high as Africa between Northern Africa and Sub-Saharan Africa as we've seen in the pandemic. South Africa, just in terms of raw numbers of cases, is still the biggest thing happening outside of Northern Africa and Africa, but again, it's quite broad. And so we got up to almost 750,000 cases on Friday, and that's getting close to the 800 and some where we peaked. So for individual country models, these are the R-squareds. This outlier is Ecuador. Turkey, actually, who had a big data kerfuffle and added 800,000 cases, has had enough cases now that that's sort of been smeared out and their R-squared isn't displaced from the regular distribution. But Ecuador, I think of all the outbreaks I track, they have the noisiest data. So this is the less interesting cumulative graph, and you can see that we have really a roughly linear growth rate since last fall with a few waves in it, and that's still going on, and those waves show up different places. This is the US, predicted to go up over the next few weeks and month. Still, this you can see a lot of concave upward down here in these medium outbreaks. It's a little hard to track them all, but France and Spain are going up. A lot of Latin America has peaked. Brazil seems to have peaked, but I'll show you those here coming up. And these are the daily cases. So the black dots are the actual numbers. The dashed black line is the sum of the country models. All the country models summed, and all this spaghetti or the ups and downs as things move from Brazil to Argentina, from the US to Europe. You can see the upswings happening. This red one is India. This is the model fit for the US, which indicates that based on the curvature, we're pretty early in this latest surge for the US. This light blue one, the UK, which was still heading up fairly strongly last month, is now appears to have peaked, which is good. These are fatalities, and a little less wavy, but the same kind of roughly linear growth since, again, last fall. Not too many concave upward sections here, except Russia. This is Russia, this brighter green one. And you'll see that coming up. And then these are the daily fatalities. And you can see that although the daily cases are approaching the peak from May, we're still markedly off of that in the fatalities. And that may be due to vaccinations, which are, certainly making their way around the world. And I'll talk a little bit about that in the vaccine section. So these are the largest outbreaks. I always show the 5 biggest outbreaks. So Russia, which was briefly displaced by Turkey last month, has come back into the top 5 largest outbreaks. So we've got a couple in Europe, one in North America, one in South Asia, and one in South America. And you can see the US as well as Turkey and Russia are experiencing case growth. This little turnover of Russia, the model is still fitting it as increasing, but we'll have to see if this really is a peak here over the coming month. India is leveled out, at really a pretty high 40, 50,000 cases a day is a lot of cases. But, you've got a 1.3 billion people, so the population rate isn't that high, but it isn't resurging again, like many other places you'll see. And Brazil, is coming down. They've had periods where they go down a bit before. We'll have to see, again, how this plays out over the next month, but they're, in the neighborhood of half as many daily cases as they were at the peak in June or late May. So in Western Europe, the larger outbreaks after Russia, this is the UK, and you can see it appears like it peaked, very, very sharp peak here towards the end of June, early part of July, and seems to be coming down. Spain is still going up. Italy looks like it's turning up. And Germany also looks like it's turning up, although the model isn't fitting it that way right now. But this is pretty broad across Western Europe. It's a little different in Eastern Europe this time, but in Western Europe, this is a pretty common trend.
And France. Sorry.
France.
Yeah,
Yes.
France was on the earlier page.
Yes, yeah, because they were in the top 5, yep. One thing that's a characteristic of a lot of outbreaks, particularly in the West, is that deaths are not increasing in the same way that they did in previous resurgences. So, the UK, if we go back here, they started going up in the middle of May. They started to have a very large surge in cases. But if you look, we've had a very small uptick in deaths really only recently, which in previous outbreaks we would have expected an earlier and a more significant increase in fatalities. And the same here in, I think this one's Spain. I can't actually see it on my screen for some reason. It may be related to the relatively high vaccination rates. Western Europe, a lot of places have passed the US now in the degree to which the population is vaccinated. So people may get sick, but that vaccinated fraction of the population is way less likely to die. And that may be what we're seeing in this kind of different evolution of these resurgences where we have pretty large numbers of cases and relatively small or very much lagging deaths. We'll see how it goes as time goes on. Latin America, for the most part, is doing much better than it was last month. Again, I always make the comment, it's usually, 2 or 3 of them are up and the other ones are coming down, and then the next month it's flipped. Well, this month they're pretty much all coming down from their peak except Mexico, which is surging and is hitting new high levels in daily new cases for the pandemic. But Peru, Colombia, Argentina, Chile, Brazil, all the major outbreaks in Latin America are subsiding, it appears. In Western Asia, not as much. So lots of new peaks being reached in Western Asia. Turkey, after coming down from this most recent peak, was settled in at 5,000 cases a day or so, and now they're up to 25 almost. Iran, which has had a very bumpy, hard to fit outbreak throughout this pandemic, is now also at record new levels of daily new cases. Israel, which has one of the highest vaccination rates in the world, is also seeing a significant surge in cases. And Iraq, which had peaked and was coming down all the way through May and into June, is now turned up again, and especially in the last few weeks has seen a lot of growth. When these X's are far apart, there's a lot of case growth. And in Eastern Europe, other than Russia, which is certainly seeing some resurgence, and maybe it's peaked, and maybe not, we're not seeing the same resurgence in Eastern Europe as we see right now in Western Europe. Poland, Ukraine, Czechia, Romania, Belarus is pretty much under control. It again dropped out of the 50 largest outbreaks as other outbreaks passed it. But Eastern Europe is harder to find resurgence than Western Europe. South Asia, on the other hand, is starting to see resurgences other than India. Bangladesh, you can see it's very high level of cases. Pakistan has been going up for a month and a half and still going up. And Nepal, which had a big surge in mid to late May, and then had come way down, is now over the last 4 to 6 weeks has started a resurgence again. The model's fitting it as a peak, but it's too uncertain until it really settles out one way or the other. But certainly outside of India, the outbreaks are worsening in South Asia. The other thing that's different, of course, Tunisia, I mentioned, is new to the top 50. They had a very big surge in June and the early part of July that raised their overall case numbers. That appears like it's peaked. Morocco does not appear like it's peaked, and it's hitting new records. Lebanon, after coming down from the winter surge that many countries saw, is now heading back up again. And Israel, as I mentioned, is heading back up again. And then Southeast Asia, which is kind of a new significant spot. Malaysia's been creeping up for a while. The Philippines have had some surges, but Thailand, had been just a poster child for the pandemic for the whole more than a year, with things very well under control, is now very much out of control. Cases reaching about 20,000 new cases a day. Indonesia may have peaked recently. Certainly the model's fitting it like that, but still very, very significant numbers of new cases a day in Indonesia. So just recall from the regional graph, this is now about 15% of the global cases coming from Southeast Asia, which is a very big change from the whole rest of the pandemic. And then there are a couple other isolated hotspots. Kazakhstan in Central Asia is shooting way up after having sort of a bumpy but never huge resurgence. Japan, whether it's associated with the Olympics or a reason to have rethought the Olympics, for sure it's that. They're seeing record numbers of daily new cases, and certainly in the period of time that's coincident with when the Olympics have been going on, the rate of increase of daily new cases has increased. And South Africa is just coming down from its third big peak of the pandemic, and it does look like it's coming down now. So as you can see from that, pretty much any region you go to, you can find either a bunch or a couple of outbreaks that are as bad as they've been pretty much during the course of the pandemic. So for the US states, these are the R squareds. These are actually a little better than last month in terms of the minimum ones, but several of the states really could use a fifth outbreak. See, in the US graph is one of the more clear ones. You have these peaks in the derivative. So there's 3 there, and this is really a 4th. But since I only have, and then this is a 5th. But since the model only has 4, I have to kind of just smear this into one outbreak. So my plan is for next month to fix that, but it's not fixed this month. So in the US, looking at the 50 states and DC, the sum of the states models, there's 2 ways I can estimate. One is, I estimate each individual state and then add that up. And that predicts about 75 million cases for the US, which is a lot. I tend not to believe it, but that's what it says. On about 900,000 deaths. So that would be about a 1.1% case fatality risk. The actual time zero right now case fatality risk is about 1.8. And that is a little less than double last month, and is about 20% higher in deaths. And as you'll see, resurgences have emerged in essentially all states. If I look at the individual country model, where I just model the US with this 4-outbreak model, predicts about 50 million cases and about 650,000 fatalities. Significant case growth, not that significant fatality growth, and about a 1.3% case fatality risk. So another thing I look at, is each month that I do these is how much more of the population was confirmed as a case of COVID. And so over the last month, it's about 0.5%, 0.4%, which is about triple. It was about 0.12% in the June month, the month before the June update. But it's a lot slower. It was more than 1% a month in the worst part of the November to January timeframe. But it's about triple where it was last month in terms of how many cases we confirmed. In terms of vaccination, about 3% of the population received a vaccine over the last month. So it was about 4% last month, so it's gone down. And it was about 6% the month before that, so it's gone down from that. So the vaccination rates continue to decline. I'll show some graphs that it may be ticking up. Some places like Missouri is actually in the per capita new vaccinations is actually near the top now, because they've had some pretty horrible outbreaks among their unvaccinated population. But still, the vaccination rates, we're making still pretty slow progress getting that last 40% of the population vaccinated. So these are some of the states' cumulative models, and so you can see several. This purple one is Florida, this is California, this is Texas. Just about everybody has a concave upward end to their cumulative case graph. And when you look at the daily cases, you can see it much more clearly that cases are going up a lot. Now, one of the artifacts of Florida's change is that because they report their whole week's worth of cases on Friday, it's inflating this number a bit. And I'll have to change perhaps the way I average things or something. But the model is fitting, what looks like a very huge 100,000 case surge in Florida that happened on Friday, when really it was just 15,000 cases a day for a week. That's amplifying this a little bit, and it's making Florida's numbers unbelievable. And that's one of the reasons I'm skeptical of the 75 million case prediction. These are fatalities, and for the most part, fatalities aren't going up the same way that cases are. Florida, again, is a little bit of an exception, and that may be because of the lumpiness in their data. And these are the daily fatality rates, and this uptick is happening. And again, this purple is Florida. So certainly cases are going up. It's not just Florida. They might not be going up quite as dramatically in the recent days as it appears because of the Florida data treatment. Fatalities look like they're going up a little bit, but it's, again, similar to the UK. It's not in the same pattern as it has been with other surges in the pandemic. So cases are rising. I'll show the map on the next page, but cases are rising in all states. And if you remember in the previous months, I was looking at 7 states that accounted for about 40% of the new cases. Now these 5 states account for 50% of the new cases over the last 2 weeks. So there is a lot of case growth in some states. And some of them are the big states, Florida, California, and Texas. But some of them are very new. Louisiana and Missouri haven't been on this list ever, as I recall. And then here's the note about Florida moving to reporting once a week on Friday. And so this Florida outbreak, is exaggeratedly, dramatic because of that big Friday dump. If you take the average daily cases of what they reported this week versus last week, it's up 50%. So it's very significantly growing, but this is overdoing it because of that. In this table, as usual, there's the percent of the country's new cases for which that state accounted over the last 2 weeks versus the percent of the population. And if the new cases are disproportionate by more than 1.25 to the share of the population, so what would we expect if the cases were even? I make it red and bold, highlighted. So Florida clearly, with or without this lumpy data, is contributing far more cases than you'd expect based on its population. California is slightly less. Texas is 1.24 instead of 1.25, so they're not bold and red, but they're as close as you get without being bold and red. Louisiana is about 3x, so about 1.4% of the population and about 5.2% of the new cases in the country in the last couple of weeks. And Missouri is about double, so almost 4 compared to 2. And you can see Louisiana is one of the 3 states this past week hit a new all-time high in daily cases that they hit on Friday. And again, Florida is also calculated as that, but remember the little Florida wackiness in the data. And in reality, they're probably close to a new daily high, but they're not as, again, it's just not as dramatic as on the graph because of that. So this is the map. I think this is only the second time that the map has been all colored in. So there's no uncolored in spots on the map. The only other time I think that happened was in January. So all 50 states and DC had more cases in the last 7 days than the 7 before that. Last month it was 19, which is consistent with things being sort of flat. That was my interpretation of it last month, that, you know, if things are flat, then randomly half the states will be up, half will be down, and we have 19. So it looked like things had leveled off. Things aren't leveled off anymore. 3 states hit a new high in daily cases this month: Florida, Louisiana, and Hawaii, where my daughter just landed in Hawaii. That's a big change from last month, where we had no new highs in daily cases, and we had 19 out of 51 of the jurisdictions I tracked were higher. So looking more specifically at California, these are the county models. Nothing particularly weird to say about the California data. It's been all right. So I model the 30 largest counties in California. The sum of the counties models predicts about 7.5 million cases for California, which is a lot, about double of last month. I'm not sure if I really believe it yet, but that's what it's fitting. There are a lot of counties that have had weeks of significant case growth. And it predicts about 70,000 deaths, which isn't that much different than we have now. So not a lot of fatality growth predicted. It's a little under 1% CFR, which is a little bit below where we are now. And that is driven by the fact that the case prediction is going way up and the death prediction is staying about the same. Well, this is, you'll see on the next one, this is LA County, which I always pull out because it's just such a huge chunk of California that usually it looks pretty much like California. But you can see here in LA County, cases have been going up for quite a while, month and a half. Deaths are just starting to inch up a little bit. So repeating again, this is different behavior than we've seen before. If that's vaccination or something else, I'm not sure, but it's different. So these are the cumulative sum of the county models, and you can see it's concave upward pretty much everywhere, except maybe Fresno, and I think this is Santa Clara. But the big counties here, Orange County and San Diego, is really going up. LA, Riverside, everybody seems to be going up in daily new cases. And the last time the graph, well, I guess, you know, the graph at the end of last year where all these things were going up and it looked kind of like this, we didn't actually have these peaks and flats. Everything was going up. It's not quite like it was in December when it was really startlingly increasing, but it is increasing significantly in daily cases, and that's broadly in both Northern and Southern California, the large outbreaks. These are fatalities, and you'll notice these aren't concave upward. All right, they're relatively flat. Some are a little bit linear increases, but we're not seeing that upturn in fatalities with the individual county models or some of the states models. But we can see it's separating a little bit the actual data from some of the county models. And these are the daily fatality rates, the actual ones, which have been pretty level, maybe turning up just a little bit, but we don't see that being fit significantly in the large county outbreak models. So how about Santa Barbara? Well, we're kind of swimming in the same water as everybody else. So our cases are going up after, really being down quite low at the end of June, single digit cases a day. I don't think we had a day where we had no new cases, but we had some where we had 1 or 2, but now we're getting 100 again. So cases definitely are turning up. Fatalities, can't say that they're turning up. This is, one fatality that we had recently in the last couple of days, but as things average out, we're just bouncing around here and, a death every 3 or 4 days, something like that. Prison has not had a new case in quite a long time. Hospitalizations upticked. We got back up over 20. I think we peaked around 23, and then it went a little bit back down. But it was 200 in January. So it's still not like it was at all, but it is going up a little bit. The other big change is positivity. So testing positivity was down well under 2%. And now it's up to about 7. I think it was 6.8 on July 24th and going up. And then for some reason, the county data stops there. So I'm not sure what the trend has been over the last week, but it's all these things are pretty much back when we had colored tiers were purple again. So you look at the case rate, look at positivity. We're in what used to be purple when we were all locked down quite, a lot, but we're not anymore. So we'll see, how this plays out as this continues. I think there may be some relief from the degree of vaccination, reducing some of the degree of hospitalizations. I think in a lot of the states that are having trouble, overwhelmingly, the people that are in the hospital are unvaccinated. Some of the cases are people that are vaccinated, but the people in the hospital and the people that are dying are overwhelmingly unvaccinated. We have a lot of unvaccinated people in Santa Barbara too. Case fatality rate has been stable at about 1.3, so a little better than the national average. So the neighboring counties look similar. I mean, I think our outbreak may actually be a little bit bigger. This is Santa Barbara. We're at about 8% of people have had COVID, very similar to San Luis Obispo. Ventura is closer to 10. I'll have to fix that. And Kern, which is a sort of a kitty corner neighbor, is about 13 almost. But you can see the similar progression where things are turning up really across the counties in California and across the states in the US. Okay, let's talk a little bit about variants. Last month, Alpha variant, the UK variant, was the predominant variant in the world. If you drew this line here, when we did it, the sequencing that we had, really it's the sequencing we had received in May that was reported into the database by late June. Alpha was still the predominant variant. Now it is Delta. So globally, 70%, I think, of the cases or so that have been sequenced in July from samples taken in July are Delta. And I'll show some graphs. You can see that how prevalent that is. The actual substitution rate for mutations decreased slightly. So it went from about 26 to about 25.4 a month or per year. It's still about 2 a month in terms of the center point of the virus population, how many base pairs it deviates from the original variant of the virus. But it's still pretty steady. Variants continue to be generated as expected. We'll see how that changes over time as we, as a planet, we continue to have a very healthy incubator for making lots of variant experiments. This is the cheat sheet. There isn't really much that's changed on this. I think this may have been a question mark last month, and now CDC officially indicates it's increased transmissibility of Delta, which they're relatively conservative in putting stuff in here. And the only one still for which they've really declared an increased disease severity is Alpha, although I think there are indications that that's true also for Delta. The other one that I put on here, it's not yet classified by the CDC as Lambda, that emerged in Peru. I'll have a slide about that next. But it is an interesting variant, and I included it because it has largely displaced P1 in Peru. So that indicates it's likely to be, my expectation is eventually it'll be a variant of concern unless it gets sort of made extinct by Delta, which is a possibility. So this is Lambda. And this is Peru's variant graph. So this sort of raspberry colored part is Lambda. And you can see that, at the beginning of the year, Peru was significantly, the only variants that it had were essentially P1. And then over the course of 2021, that's been displaced by Lambda. You can see P1 coming up a little bit here, but this is, again, on these graphs, this is a very small number of samples because it's the last one. So we look in here in the main part, the Lambda variant has really become the dominant variant in Peru. And it has some interesting features that may enable it to evade the antibodies. So similar to Delta, it has a mutation at 452 position of the spike protein. And for those of you who remember last month, all the mutation nomenclature, it's a little bit different. It's glutamine instead of arginine, which is chemically a little bit different, but it's in the same position that Delta has the arginine residue. Interestingly, it also has the actual excision, so the removal of 7 amino acids from the spike protein in a region that is believed to be associated with where the antibodies recognize the protein and latch on. So that may be another thing that may enable it to succeed versus all the other variants. But on the other hand, it has a couple of the other mutations that some of the other variants of concern have. So the N501Y that is associated with transmissibility in alpha, for example, but Delta doesn't have that either. And it also does not have the 484K or Q mutation, which again, Delta doesn't have either, but a lot of the other variants do. So it'll be interesting to see. This hasn't really been detected much in the US yet, but it is here. But it may be the next one to pay attention to. And this is how the variants that are prevalent in different places look. And as you can see, Delta has really become far and away the most successful variant globally. This is the UK, this is the US. So, from last month to this month, we changed from an alpha pandemic to a Delta pandemic. Even South Africa, which had really avoided alpha because they had their beta variant in South Africa, has now been almost completely displaced by Delta. Indonesia, which has had quite a severe surge in their outbreak, is Delta. And the recent surge in Japan that I showed is, now 75–80% Delta. And this is how it looks in the US in the CDC representation. So over the period from late April to mid-July, we went from no B.1.617.2 is Delta. And we went from, Alpha and P1 growing, and then Delta just really displaced both of them. So Alpha, shrank to this, P1 shrank to this, and it's now the dominant virus in the US, dominant strain in the US. And these are the states. So this is California, which is about 90% Delta. that's not a lot different than than a lot of other states. Missouri, these are the 5 states that were on the list of accounting for half the new cases, and you can see that they're all overwhelmingly the Delta variant. And this is at Santa Barbara County, the reporting. And so far in July, we've only had about 15 cases sequenced, so there's a pretty big uncertainty band around these percentages. But the only viral strains detected so far in Santa Barbara County in July have been either Delta or P1 Gamma. There hasn't been an alpha case detected in July yet. Certainly was in June. It was pretty much neck and neck with Delta, but nothing in July. And then again, I'll put this, we do have fewer cases than we had when we were having, our biggest numbers of cases, but even proportionally, we are sequencing fewer cases than we were at the peak, whether you look at absolute numbers or as a fraction of the new cases. So we were at 200 or 300 cases, sequences a month in February through April, and then we're 30, 20, and 15 so far in July. Now, July sequences are going to be coming in through August still because there's a relative lag there. But so these numbers have to be viewed with that lens of uncertainty in terms of the absolute percentages. But at any rate, the 15 cases sequenced in July have been mostly Delta with some P1. So no garden variety COVID anymore being detected in Santa Barbara since May. All right, talk a little bit about vaccines. So this is the way the global percent of the population that's been vaccinated has evolved. And of course, the US here, we're out to kind of a good lead, then we're slowing down. Turns up a little bit at the end. I'll talk a little bit about that. But in the meantime, we got passed by a bunch of Western countries. Brazil is coming up and probably pass us in the next month unless our rates change. This China legend here is a little misleading. It's just this dot. So China doesn't report a time series of vaccinations. They just reported in June that they had vaccinated 43% of their population or something, which is a huge amount of vaccines. But that's why this is weird, 2 things pointing to one line. This is actually Malaysia, which is coming up, but is having, as you saw in that graph, quite a big outbreak. Japan is having a big outbreak. Now, all these down here that are relatively low are all having a big outbreak. And then this number is the world. So the world is getting up to about 28% of the world has received at least 1 dose of vaccine, which is, pretty, when you stop and think about it, it's pretty amazing. It's more than 2 billion people have received at least 1 dose of vaccine, which is a very big number. But there's a huge range, right? We have some over 70, some that are much lower that could use it, particularly these sort of more developing countries with big outbreaks. About 6% increase globally since June. So the US went up about 3%, the world went up about 6% in terms of its fraction that's received at least 1 dose. It's not stamping out any new cases. The level of vaccine that we have. So these countries, that have pretty high vaccination rates, 60 or 70% in some cases, are still experiencing case growth, even at those vaccination levels. This is the way the US daily vaccine dose delivery looks. There's a little, Pennsylvania had some snafu in their data. You can see a couple of them here where there's some illogical things happening. Pennsylvania had a big negative number, and then a couple weeks later had a big positive number that still shows up in the data. But some of the, like as I mentioned, Missouri is now on a per population basis has one of the highest vaccination rates in the country. I think the second highest state, and they've had a very big 4x what was expected from their population in terms of cases. And that does seem to be inspiring some people that previously hadn't gotten the vaccine to get it. But nevertheless, compared to where we were in April, with averaging almost 1 per 100 nationally per day, we, have just gone up from less than 0.2, a lot of that were 0.1 up to, in some cases, 0.3 or 0.4, but still a lot less than our peak. And, we have about 58% of the population has received at least one dose. So that's not where we were aiming, where the public health folks were aiming to get to herd immunity or a place where we can not worry so much about community transmission. 50% are fully vaccinated. For the elderly population, it's pretty good. 90% have received at least one dose, and 80% of the people over 65 are fully vaccinated. So the herd immunity numbers that are batted around of 80 or 85%, that's being realized, but really only in the elderly population so far. When we look at the states, one thing I wanted to look at was, so we've got this distribution. It's about 2 to 1. So you go from Vermont is about 76% vaccinated. That's the highest among the states. Mississippi, it's about 40%. So we have about a 2 to 1 difference in terms of the fraction of the population that's been vaccinated. So does that correspond to anything we can see in the cases? So this is a correlation of the percent of the population that's fully vaccinated. Each point on here is a state. And then the new cases per 1,000 in July so far. So between 630 and 730. Those are those plots, and you fit a line, you can see it's pretty noisy. The R squared is only about 0.24, I think, for the one on the left. But the significance of it, so the statistical chance you would have this relationship if there was really no relationship between these things, is low. There's very, very high statistical confidence there is a relationship between the percent of the population that's vaccinated and the new cases that have been experienced per 1,000 over the last month. And the same thing with fatalities, less than 1 in 10,000 chance that this would occur randomly. And you can see that, the places with very high deaths per million over the last month are also places below median in vaccination percentage. Now here's Mississippi, Louisiana, that's had this huge surge in cases, and also fatalities. Across all the states, when you look at the last month, the population rates of new cases and fatalities are correlated to the rates of vaccinations with a very high degree of statistical confidence. So I was figuring what I was going to put here, because it bothered me a little bit that I was even thinking it would be worthwhile to put together a chart to say, well, vaccines prevent disease, because I think that's been pretty well established. Although there seems to be some debate about that. So anyhow, it's very consistent with what I figured we all knew going in, which is that vaccines do, in fact, prevent disease. This is the Santa Barbara County data. So, we have, again, not a dissimilar looking pattern than the rest of the country. So as vaccine became available and distributed, the daily doses grew a lot, and they've continued to fall. They've been pretty flat through July, but lower than June. It's about 600 doses a day here in the county. 59% of our population is vaccinated. It rose about 3%, so similar to the US, it rose about 3%. 52% is fully vaccinated. Of the folks eligible, so the people under 12 that aren't eligible, exclude those, and we're about 70% have received at least one dose, and 62% are fully vaccinated. So it's a little better because, we can't vaccinate the people who aren't eligible, but of the people who are eligible, we're still about 6 out of 10 of those are fully vaccinated. Here you can see down at the bottom right, the pretty flat daily doses that were being delivered through July. And another does vaccination help graph. Vaccinations and new cases in Santa Barbara. This is a new graph they've started publishing on the Public Health Department, which is good. I'm very glad they're pulling this data out of their public health records. So this dark red line is the daily case rate per 100,000, so new cases of COVID per 100,000 among the unvaccinated population, and the blue tealy one is vaccinated population. So you can see it's about a 7-fold difference between those two numbers right now. So within Santa Barbara County, if you're a new case of COVID, you're about 7 times as likely to be unvaccinated as vaccinated. I think that's been commented a lot. This current wave is really being driven in the unvaccinated population. So hopefully that uptick we see in U.S. daily vaccinations will grow over the next months. So that's all the graphs and stats stuff. So the overall comments, the model estimates for the world about 300 million cases and about 7 million deaths. That's gone up significantly from last month, about 40%. Deaths just went up slightly. Again, that common theme. Cases are really going up. Deaths, just a little. It again always this disclaimer. It assumes that the current outbreaks proceed the way that they are trending now, and no new outbreaks or resurgences occur, which is unlikely. As you recall, earlier in the year was the calculation of the case fatality risk on the most recent cohorts of cases. It looked like it was going up, and it's returned back to where it was, and I think is likely to trend down based on the trends we're seeing in the case growth versus fatality growth and the distribution of the vaccine. That's what I've got for this month. So if there are any questions, I'd be happy to answer them.
One question is India. I saw someplace recently that like 2/3 of their population was showing antibodies, which seems pretty staggering.
Wow.
But so it's like they had huge numbers of people that got it, but weren't tested or and survived. So I don't know. It's very strange. But something seems to be keeping them from getting more cases. So either they're cooking the books or something strange going on. But that was the most interesting thing I saw that didn't seem to make it big in the news.
Yeah, I'll have to look at that. The seroprevalence is that high. I think the other thing that is maybe balancing that out is that the rules about deaths and funerals really motivated people to not report deaths as COVID deaths.
Yeah.
So there may have been, both in terms of cases and in terms of fatalities, a whole unmeasured part of the pandemic that went through there. Because certainly hospitalizations and everything were overwhelming. We work with some suppliers in India, and they need oxygen to run their plants, and they had to turn their plants off because just the entire country did not make enough oxygen to keep the hospitals going.
Yeah, Dave, I had mentioned that a day or two ago, I saw that they're talking about Indonesia as being a new hotspot, and that what they're seeing now is children dying from COVID, children under 5, among the unvaccinated. Did you hear anything else about that or any?
No, I didn't. You mentioned that, which is very fascinating. I mean, Indonesia is the Delta variant, similar to what we have here. So I don't have a hypothesis to why that may be happening. It would be in terms of all the demographic stuff I've looked at, it would be a unique outcome among all the outbreaks I've looked at where those data are available. Mm-hmm. But that's very interesting.
One other thought I had looking at the data is wonder if there's a chance that the Delta variant causes a longer lag between detection and death. If that's the reason that it isn't ticking up and that it's just a time bomb waiting to go off, or whether how much of it is the hospitals are able to treat it better, even unvaccinated people. But I guess we'll just see how that plays out.
Yeah. It could be the lag. And it could be, and making up hypotheses on the fly here. But there's such a higher load in the upper part of the respiratory system that normally with the other SARS viruses, that was associated with being more contagious but less fatal because of it's when it gets into the lower part of the respiratory system that causes very severe disease.
Oh, okay.
So, and the high viral load that people are starting to measure in the upper part of the respiratory system that makes it easy to give to everybody may make the fatalities either not happen or happen later in the disease progression. Yeah.
Okay, yeah, that's another very likely scenario, it seems. Yeah, I hadn't heard about that. Okay, thanks.
Mm-hmm.
Could any of these results be because the vaccines don't last very long?
Well, it could. I think I think there's fairly good data from the phase 3 trials that the vaccines last, I don't know, from the numbers I've seen, at least 6 months. And I mean, without really much of a measurable drop in efficacy, because they continued to measure the participants in the phase 3 trials, which were tens of thousands of people. But they did see that the efficacy began to fall away somewhere in the 6 to 12 month time frame. We're coming up just now really on the 6 months since we started having a significant fraction of the proportion of the people vaccinated. So I think we'll see how that works as this resurgence plays out, right? So in the next couple months, as this thing either peaks and starts to fade or doesn't, we'll be coming up on the time where the phase 3 trials detected some measurable declines in the vaccine efficacy. But that's a very good question, and it's an unknown. That's one of the things. How long does the vaccine last? Well, I mean, the vaccines haven't really been invented for a year yet, so it's really just not possible to know exactly. Well, how well does the vaccine work after a year? You just can't know.
Hey, Dave, I was wondering on that, I call it the feather chart, the one that has all the different variants,
Yeah.
the color coding on it, where it says like the Delta variant or something, there's all those different dots. Does that mean they're all those green dots up there at the top are just different versions of Delta, or how do we interpret that? Is every dot a different variant that's been sequenced in that chart?
Yes. Yeah.
Okay.
Every dot is a different variant. There are 30,000 base pairs, and they have to classify them somehow rather than just each one individual. Although it's likely there will be one or two base pairs different among many things that are all the Delta variant.
Mm-hmm.
So you'd have to go in, and that's why they classify them with these clades. So the same color all belongs to the same clade, but it may not be exactly 30,000 for 30,000, the exact same sequence, genomic sequence.
But it would just mean like in that critical area that you talk about that defines it as Delta, all of those dots have that in common?
Yep.
Okay.
And if they're separated in Y,
Mm-hmm.
they're separated in the number of base pairs by which they deviate from the original virus.
Okay.
One other thought, is this Delta going to change kind of your R0? In other words, the number of people you need for herd immunity? It would seem like it would.
Yeah, it does seem like it would. I know I heard Fauci talking one time about, they don't really know, what does it take for herd immunity? I don't know, it's too new, can't tell. But he was using measles as just a template and said, well, for that, you need about 85%. And so that's kind of the number I've been thinking about. But if we really want to get there, that's probably a good number to aim for.
When and where are you going to go on vacation as an educated person?
Well, we haven't made our next trip yet. We're thinking about Antarctica. Case level is very low in Antarctica.
And we've got the wedding in Vermont next month, right?
Yeah, I guess that's true. Yeah, we are going to Vermont next month. And I'm going on business trips to Delaware. But so far, I haven't gone out of the U.S. But not because I'd be really worried about it. More because it still seems like an ever-changing and difficult to really discern set of requirements. I've had some colleagues that have gone places and booked flights and then suddenly found, well, you can't transfer actually planes in Belgium because you'd have to stay there for 2-week quarantine, even if you're just transferring in the airport and things like that. So So we don't have any international trips planned yet, but for me, being vaccinated, I would be more worried about the rules than getting sick. I know I can still get COVID, but I'm comfortable that I'm very unlikely to have to go to the hospital or die.
Thank you.
Sure. Well, it doesn't look like it'll be over by next month, so I'll probably do this again.
Bye.
Thanks a lot, Dave.
Yeah, sure.
Always great. Thank you.